started. Hello and bonjour. I'm Paula Spivak, the outgoing president and CEO of Volunteer Canada, and I'm joining you from the unceded territory of the Algonquin Anishinaabe people. And it is with a mixture of anguish and hope that I express my gratitude for all that I receive from this land. As each person, family, neighborhood, community, organization, workplace, department, and sector finds our space and place in reconciliation, Volunteer Canada has also opened our eyes, ears, minds, and hearts wider, beginning with the excellent Truth and Reconciliation Working Group of the Volunteer Centre Council. As we approach the Day of Truth and Reconciliation, let us take the opportunity to learn, reflect, and plan for our next steps. Colonialism, oppression, white supremacy, and systemic racism have caused harm to many people in Canada and around the world, and in doing so, we have all been harmed. May we support and accompany each other on our individual and collective journeys towards a society built on justice, respect, equality, and harmony, so that we may all thrive and prosper as diverse and connected communities and nations. Welcome to today's webinar. This is part of our series on the volunteer factor, and today we are looking at considerations for developing vaccination policies. Our series is sponsored by Canada Life and BMS through the Under Our Wing insurance policy program that we have at Volunteer Canada. A few important logistics before we start. The webinar is being recorded. However, we are not going to be recording the Q&A portion of the webinar at the end. So feel free to ask your questions freely. And as I mentioned, we won't be recording that portion of the presentation. If you can look at the bottom of your screen and ask your questions in the Q&A icon, that would be terrific. And we will also do our best to follow up with any resources that we can either during the webinar or afterwards. We'll also let you know where you can get the recording of the webinar. So with that, I just want to give a few words of introduction to the topic and then introduce our fantastic speaker. So first of all, for those of you who don't know Volunteer Canada, you see that our vision is involve Canadians, resilient communities, and a vibrant Canada. And we provide national leadership and expertise on volunteering, not just to have people busy, but because we believe that by increasing the participation, quality, and diversity of volunteer experiences, we're building stronger and connected communities. And we don't do this work alone. We work with more than 200 local volunteer centers, businesses, educational institutions, government departments, and volunteers. Many of you are with us today. So we are using the term employer, the topic of this webinar, considerations for employers in terms of developing vaccination policies. We're using the term employer to refer to those organizations that engage people in their work, whether these people are paid employees, volunteers, co-op students, contractors, or those providing pro bono services. As referenced in the 10 steps of screening and the screening handbook that we developed with Public Safety Canada, our policies need to be based on what a person does in an organization and not what their employment status is. Organizations have a duty of care to provide safe environments for all of those doing work on their behalf that adheres to legislation related to human rights, protection of privacy, occupational health and safety, labor law, disabilities acts, youth protection acts, employment law, and much more. Organizations also have a responsibility for all the work that is done in their name on their behalf, whether it is done by a paid employee, volunteer, student on placement, pro bono services from a corporation, student, etc. Organizations have a duty of care to their members, clients, patients, participants, all those that access their programs and services. So as mentioned, although we're using the term employer that many people associate with paid employment, we're really using it in a broader sense. So with that, I'm going to introduce our speaker today. Krista Schofer is a partner in Gowling LLP's Calgary office, practicing in employment, labor, and equalities, immigration law, and privacy groups. Krista leads the Western Canadian immigration practice, counseling corporate clients seeking to hire foreign nationals in Canada and or the United States, and developing strategies to manage global workforces and cross-border travel. She has extensive experience advising on Canadian immigration compliance and various Canadian immigration options, including the labor market impact assessment, exempt work permits, work permit exemptions, and other applications, study permits, visitor records, temporary resident visas, permanent residency, and citizenship. Krista also provides advice on non-immigrant and immigrant status in the U.S., preparing petitions in a variety of categories for both temporary and permanent status. In Krista's employment practice, she focuses on management-side labor and employment law. She advises on human resources, labor relations, human rights and privacy issues, encompassing all aspects of the employment relationship, from pre-employment hiring issues to performance management, termination, and post-employment obligations. In her privacy practice, Krista advises companies on privacy compliance and data protection, including compliance with the Personal Information and Protection Electronic Documents Act, the PIDA, provincial privacy laws, and laws governing the protection of health information. Krista regularly drafts privacy policies and data protection agreements and provides privacy training for clients. She has a vast array of experience, and as you can see, has been instrumental in creating excellent resources and information for organizations of all sizes in all areas of the country on this very important topic, vaccination policies. Again, we want to remind you that Krista is going to be providing you with general information. She's not going to be providing any legal advice to any organization. And that is because, as we know, every situation is different, every organization is different, every territory and province have different legislation, and we're in an evolving situation that's dynamic. So with that in mind, I will turn it over to Krista.
Hi, everyone. Thank you for having me, and thank you for that introduction. It wasn't needed, such a lengthy one, but I really appreciate it. So I was asked today to attend and speak about COVID-19 vaccination policies. I am getting questions around vaccination policies on a regular basis, and I anticipate that this will continue for the next several months. It's certainly a hot topic for organizations right now. So if we can skip to the agenda, perfect. So I am going to start with a quick overview of what we're seeing in vaccination policies across Canada. Although this may not be relevant to everybody in terms of every province I'll mention, but I do find it quite interesting to look at what is going on across the country. We have someone, so Gowling's is a national firm, and we have someone in our employment group that updates us on a daily basis in terms of different vaccination policies in different companies and the public sector that are implementing policies. So it is something that is changing rapidly, but it is very interesting to see who is adopting these policies. I will then outline the types of vaccination policies that I have been seeing. We will discuss the applicable legislation regarding these vaccination policies and considerations to think about if you are choosing to implement a vaccination policy. And then we will have a Q&A period at the end. And before I get started, I know Paula had mentioned this, but I just wanted to reiterate that please don't rely on this as legal advice. This is for information purposes only. And because things are changing so quickly, please also don't rely on this for information in a month's time or even a few weeks' time. And that's because orders in provinces and recommendations from our health professionals are changing so quickly. So what is current today may not be and is likely not going to be current in a month, unfortunately. So starting with what is happening across Canada, I will be starting with Alberta, and that's only because I'm based here. So the provincial government has declared a state of public health emergency. The government implemented the restrictions exemptions program, which private businesses can decide to opt into. So how this program works is that businesses and events must either require proof of vaccination or a negative rapid test. And if they don't do that, then they'll be subject to the capacity and operating restrictions that have recently been implemented by the Alberta government. Businesses that are out of scope or who choose not to fully implement the program must comply with these new health restrictions. Some businesses are exempt, and those are typically those businesses that need to be accessed by the public for daily living. On September 22nd, the City of Calgary passed its own bylaw, which is similar to the Alberta Restrictions Exemption Program. However, they require businesses to mandate this proof of vaccination or the negative test or medical exemption letter. They don't allow those businesses to opt in or opt out. And as of September 16th, we now have vaccination records that are available for printing or downloading. In BC, effective September 13th, proof of vaccination is now required in the province for people attending certain non-essential social and recreational settings and events. Individuals must receive their first dose by September 13th and be fully vaccinated by October 24th. Effective September 27th, so just 2 days ago, people in BC must use a digital or paper copy of the province's vaccine card. So original proof of vaccine is no longer accepted. And the BC government has indicated that medical exemptions to the vaccination card will only be allowed in extremely rare cases. Effective September 13th, all long-term care and assisted living facility employees are required to have at least one dose of the vaccine, and they must be fully vaccinated by October 12th. UBC confirmed that it's requiring all 90,000 of its students, faculty, and staff to provide proof of vaccination. Effective October 26th, all employees and volunteers at healthcare facilities in BC must be vaccinated, and any unvaccinated individuals will be put on unpaid leave with accommodations for those with medical reasons. And then this is more recent, but the provincial health officer, Dr. Bonnie Henry, said that BC is preparing to offer vaccines to children aged 6 to 11 as soon as it receives approval from Health Canada. We can skip to the next slide. In Saskatchewan, effective September 10th, all Saskatchewan Health Authority employees are required to provide proof of vaccination or a negative test. As of September 16th, Saskatchewan reinstated their mask requirements for all indoor public spaces. During the week of September 20th, Saskatchewan launched the verifiable record of vaccination, which includes a unique QR code. As of October 1st, individuals must show proof of vaccination or proof of negative COVID test to access certain indoor businesses and services. And again, as of October 1st, all provincial employees must be fully vaccinated or get regular testing for COVID. In Manitoba, as of September 3rd or 7th, depending on the business, individuals must show proof of COVID vaccination to access non-essential businesses. As of October 18th, designated public sector workplaces will be required to make rapid testing available on site for employees who choose not to be vaccinated, are not fully vaccinated, or cannot show proof of vaccination. And the City of Winnipeg has stated that it will require all staff who work regularly with the public to be fully vaccinated by November 15th. Next slide, please. In Ontario, on August 17th, the government announced that mandatory vaccination is required in high-risk settings, and what is included in high-risk settings is quite broad. As of August 24th, organizations are required to comply with any advice, recommendations, or instructions issued by the Chief Medical Officer of Health regarding vaccination policies. And this is interesting because it goes beyond just needing to comply with orders, which are in effect law. Businesses also have to comply with advice, recommendations, or instructions, which is quite broad. Since that statement on August 24th, at least 11 regional medical officers of health across Ontario have recommended that private businesses implement a vaccination policy for their staff. On September 7th, the Chief Medical Officer issued instructions to boards and private schools to establish mandatory COVID-19 policies, and these must have been implemented by September 27th. Effective September 22nd, Maple Leaf Sports and Entertainment has implemented a mandatory vaccination policy for fans attending its events indoors and outdoors. As of September 22nd, Ontarians must provide their proof of vaccination to access certain public settings and facilities. And the Ontario Ministry of Health has confirmed that there are only 2 valid medical exemptions from the vaccination. The first one is an allergic reaction, which must be confirmed by an allergist or immunologist. And the second one is if an individual suffered a severe reaction after the first dose. A few last things in Ontario. City of Toronto employees will be required to be fully vaccinated by October 30th. As of October 4th, individuals will need to show proof of COVID-19 vaccination or a negative test to enter provincial legislature. And several public health units, including Toronto, Hamilton, and Niagara region, have stated preparations have commenced to vaccinate children aged 5 to 11. Next slide, please. In Quebec, the vaccine passport took effect on September 1st to access certain businesses and activities. As of October 15th, vaccination will be mandatory for healthcare and social service workers, regardless if they have contact with patients. And as of October 15th, that same day, unvaccinated employees will be suspended without pay. Next slide. In terms of the situation in the Atlantic provinces, effective October 4th in Nova Scotia, proof of vaccination will be required for participation in discretionary, recreational, or non-essential activities. And vaccination policies are left to the businesses to develop in terms of their employees. In New Brunswick, the province reinstated a state of emergency, including a mandatory order that businesses where people gather or exercise must implement a vaccination or masking and testing workplace policy. New Brunswick will require vaccination for provincial employees. As of September 20th, St. John announced that city employees, including police, will be required to be fully vaccinated or wear a mask and get regular testing. And Fredericton will implement the same policy or a similar policy. As of September 21st, certain businesses and services must require proof of vaccination and government-issued ID, which is the case with most of the vaccine programs across the country. In Newfoundland, on September 7th, it was the first of the Atlantic provinces to announce the implementation of a proof of vaccination, and it is modeled after the Quebec system. And then finally, in PEI, they developed a provincial vaccination record system, and it will be required for all non-essential services. And long-term care and community care facility staff who are unvaccinated or partially vaccinated will have to be tested every shift up to 3 times a week and must follow masking requirements. So that's just a little update. It's kind of a taste of what we're seeing across the country. There's a clear trend in terms of both public and private bodies implementing vaccination policies in some form. There is a lot of differences between these vaccination policies.
Krista, we have 2 questions that have just come in. I'll let you know what they are because I know you'll probably incorporate them into the next part of your presentation, but just for your information. One question is, would patients count as clients if they receive care from a first responder volunteer, such as a volunteer firefighter? Second question is, can the organization perform their own rapid tests by a trained professional, or does it require going through the healthcare system? Just letting you know, those 2 questions came in, and I'm pretty sure that they'll be covered in your next part of your presentation.
Sure, yeah, just in case I don't cover the second one in particular, we're seeing companies do the rapid testing in a lot of different ways. Some companies are setting it up right at their place of business and also paying for those tests. And in terms of who needs to administer it, I don't know the answer to that off the top of my head, and I would think it would depend on the province as well. But I believe that there's a lot of guidance out there in terms of implementing these rapid testing right at your place work. But then on the other hand, I know companies are taking the position that they don't want to cover these costs associated with the rapid testing. And so they're just providing guidance to employees in terms of where they can get it done. But I know in Alberta, they won't allow people to use the free provincial testing. It has to be a private or a paid test. But then I think it was in Manitoba where certain businesses have to provide the testing free of charge to people. So it does depend on the province.
Okay, well, there's some other questions coming in, but why don't you go to the next part of your presentation and we'll see if those are covered, and then we'll get back to the questions.
Sure.
So questions coming in, everyone.
Okay, next slide, please. Okay, so in terms of the type of vaccination policies we have been seeing, I'll just start with that these policies haven't had to withstand much legal challenge to date. The exception to this is in the human rights sphere. We have seen decisions already in terms of the legality of these policies. And I will go into that in a bit more detail in a few slides. So there are clear legal risks in implementing a vaccination policy. But on the other hand, there are legal risks to not implementing these policies. So ultimately, it's a weighing of the risks. So you have OH&S versus human rights, privacy, and potentially employment law considerations. If you do choose to implement a vaccination policy, you need to be able to defend why it was reasonably necessary for your workplace to have this policy. So some of the questions you may want to start with and ask yourself and answer before you implement a policy include, is it reasonably necessary? Is it justifiable? Are there less intrusive measures that could have been used to get the same result? Is it the best way or one of the best ways to reduce the risks associated with COVID in your place of business? So a vaccination policy is key in minimizing legal risks associated with employment, privacy, and human rights. And when I say that, I mean that businesses may implement a mandatory vaccination program, but it's highly recommended that you have a policy that goes with that program. And the wording in that policy, as long as you follow it, will help reduce the risks associated with implementing the program. So in terms of the policies and what we're seeing kind of, I've lumped them into two groups. One is this vaccination status disclosure policy. So it's this quasi-mandatory policy. And the second one is our truly mandatory vaccination policies. Next slide, please. So in terms of starting with that first policy, so that quasi-mandatory one, under this, we're seeing two different ways of doing this policy. And one is where it's a voluntary disclosure of vaccination status. And the second one is a mandatory disclosure by employees, participants, volunteers, visitors. The voluntary, so this is where the organization seeks voluntary disclosure by individuals. And this is something that I saw organizations adopting at the very beginning when vaccination policies were just new, so a few months ago. And it seemed to be in the situation where an organization didn't really want to implement a policy, but dealt with third parties that did have policies in place. So they needed to know which of their workers or volunteers could visit third parties and comply with that third party's policy. So that was definitely a path that a lot of organizations were taking. For the mandatory disclosure policies, this is where you're requesting mandatory disclosure of vaccination status or proof of vaccination, but you still provide alternatives to people if they don't want to provide those details or they aren't vaccinated. And I would say this is where most of the policies right now are landing, but yet we're seeing kind of a trend to those truly mandatory vaccination policies. So I would say we're right here with the mandatory disclosure with alternatives, but we're kind of moving towards truly mandatory policies. And in terms of the alternatives that organizations are offering, it's those testing, the rapid testing, and wearing PPE, so the mask wearing policies. Next slide, please. In terms of the mandatory vaccination policies, these are the truly mandatory ones where An organization requires anyone working or entering their place of business to be vaccinated. And individuals who are not fully vaccinated or who don't want to disclose their status are precluded from participating in the activities until they comply with the policy. There are still accommodation measures that need to be considered, but it doesn't necessarily mean that those that need accommodation due to medical reasons get to fully participate. It's just that there's other methods of participating, such as curbside pickup or being able to attend outside functions, those sorts of alternatives. So as I've mentioned, we're seeing a lot of these truly mandatory policies now. I just saw this one a few days ago, but this is for maybe some of you in Toronto who are big wing eaters, but an example is the Bistro on Avenue. I saw that it's a popular wing spot in Toronto. They had stated that patrons must be vaccinated and they aren't allowing for any accommodation for medical exemptions. They are permitting curbside pickup, but if anyone's eating in the restaurant, they need to be vaccinated, kind of full stop. Another example of these mandatory policies is BC's vaccine program. There's no options under their general program for rapid testing, and there are very limited medical exemptions. And we're also seeing this, I'm sure you've seen the news in the healthcare setting in terms of healthcare professionals need to be vaccinated by a certain date. I believe in Ontario, it's been in the news this morning and last night that they're getting close to that date where healthcare workers have to show proof of vaccine or else they cannot work. Next slide, please. So in terms of legal considerations in implementing a vaccination policy, when looking at these legal considerations, it's important to keep in mind that, and Paula had mentioned this, that each province has its own legislation and associated requirements. So what I'm stating today is a very general overview, but know that the risks I'm talking about, so OH&S, employment, human rights. If you're a provincially regulated business, which most businesses are, there are some federally regulated, but if you're provincially regulated, every province has its own human rights, employment, and OH&S legislation, and there are differences across the country. The main reason why organizations are implementing vaccination policies is to comply with orders in their provinces, but also because of the occupational health and safety, the OH&S reasons, which we will talk about in the next slide. Next slide, please. So we're going to start here with the OH&S considerations. So employers, and when I say employers, I am referring to anyone who works with the public or has people in their place of business. Employers have an obligation to take every reasonable step in the circumstances to protect the health and safety of their workers. And generally, this also extends to third parties on the property. So this includes contractors and the public. Organizations must conduct hazard assessments to address hazards in the workplace, including those relating to COVID-19. An example of this, I'll go back to Alberta, but OH&S in Alberta has repeatedly stated during the pandemic that employers have an obligation to inform workers of the health hazards associated with COVID, as well as providing information and training on these hazards and how to reduce the associated risks. This was really interesting, I saw an article last night about an Ontario farm with a worker who died from COVID, and that farm is now facing 20 charges, with the charges all being under the Occupational Health and Safety Act, on the basis that the owner of the farm failed to take every precaution reasonable to protect its workers from COVID-19. And in this case, the reason for the owner having failed to meet its obligations under the Occupational Health and Safety Act was not because it didn't implement a vaccine policy, because this happened, I believe it was last spring. So this was before we saw this trend in vaccination policies. In this case, it was due to not having implemented mandatory mask wearing. The workers didn't have access to hand hygiene facilities. There's a lack of cleaning on touch services, and workers weren't given instructions to self-isolate once it was known that there were COVID cases. And I believe there were it was an outbreak at the farm, and there were over 200 COVID cases. But I wanted to just raise it because it's the first I've seen where I've actually seen charges laid in the COVID context for failure to take steps to protect the workplace.
Krista?
Yes.
There's a question here, and you've partially answered it, but whether patients and clients need whether you need separate policies for patients and clients, or whether the vaccination policy you would apply to all.
Yeah, I think that's a great question, and I think it depends on your organization and whether it makes sense to do two separate policies. I've definitely seen two separate policies where you may require mandatory vaccination for your employees and your workers, or I've actually seen different policies for different types of workers. So those maybe the higher risk workers that are in the public or with high risk groups. And then a different policy for the public. So I've seen it both ways, and it really depends on what makes sense for your organization. But there is a lot of latitude in terms of how you structure your policy so that it does make sense for your business, and it's not just everybody adopts the same policy. It really needs to be like justifiable and why you did it your way to protect your workers and the public.
Thank you.
Okay, next slide, please. So we're going to now flip to kind of the risks associated with implementing a policy, whereas the OH&S was the risk of not implementing a policy. So in terms of privacy, it is a bit different than OH&S, employment standards and human rights, in terms of different legislation applying in the provincial context as opposed to federal context. I won't get into detail on that. Just know that it can be confusing in terms of which legislation applies to your organization. And it could be that no privacy legislation applies to your organization in a certain context, especially if you're a nonprofit organization. So I just wanted to raise that as something to think about. Generally, organizations must be conscious of privacy obligations to protect the personal information of those that it collects personal information from, and this includes employees, volunteers, third-party workers, members of the public. The collection, use, and disclosure of personal information should be limited to what is reasonably required to fulfill the specific business purpose. So when you look at a vaccination policy, it should clearly outline to individuals what personal information will be collected, how such data will be used, and to whom it will be disclosed. The other part of this is if you, as part of your vaccination policy, you want to outline the part about privacy so that you have the consent of individuals when you collect their personal information. And then you also need to make sure that you're complying with that policy as an organization and that you have safeguards in place in terms of protecting that sensitive personal information. So vaccination status, details of vaccination status, that's all considered personal information, and it is considered sensitive personal information, just like I would say I'd be comparable to health-related information that you may be collecting, or SIN numbers, banking details. It is considered very sensitive information, which means you need to have those safeguards in place. In terms of starting to look at evaluating the privacy risks, it's similar to that overall assessment when you're implementing the policy, but a good starting place is thinking, are there any less intrusive measures than implementing this policy and collecting this information? If not, then what personal information do you actually need to fulfill the purpose? And how can you limit the amount of personal information being collected, used, and disclosed? And one example of something organizations are doing, and I would recommend this, is instead of actually collecting and retaining proof of vaccination and having that on your files, have one person or a few people responsible for verifying that proof of vaccination, looking at it, verifying it, and then recording it in your system as a yes or no or confirmed or not confirmed. And so you have very limited personal information that you've actually retained, as opposed to having the proof or the vaccine card on your file, which contains much more information. Next slide, please. So in terms of human rights, I just wanted to start with a note, because I know I often hear people talking about charter-based arguments. In most provinces, the Charter of Rights and Freedoms only applies to governmental actors, so public bodies, and not private organizations. So rather, our provincial human rights legislation would apply to provincially regulated private actors. And Quebec is different. I'm not going to touch on them right now. So generally with human rights, organizations do need to be aware of potential human rights grounds for refusing a vaccine. The most accepted ground has certainly been in the medical related area, and this is based on the protected ground in human rights legislation is mental or physical disability. So where individuals have made an assertion of a human rights ground, employers can request support for this. And what I mean by that is this medical documentation from a medical professional. And you don't want details on their potential physical or mental disability, but what you would be asking for is a letter from the medical professional confirming that they fall into one of these accepted reasons for not getting vaccinated. And when there is a bona fide ground, organizations and employers do need to be aware of their duty to accommodate to the point of undue hardship. As part of this duty to accommodate, organizations need to explore forms of accommodation, which may include rapid testing, other administrative or engineering controls to protect from COVID, curbside pickup. Those are a few examples. Accommodation is very fact specific, and it's typically reached when accommodation would create OH&S risks to others, or it would be extremely expensive in comparison to what is being requested. Next slide, please. So we are seeing human rights claims quite frequently in terms of both mask mandates and mandatory vaccination policies. Speaking with a commissioner in Alberta and then speaking with colleagues in other provinces, the human rights commissions are overwhelmed right now with the amount of claims that they are seeing. Just to note that even if there is no basis for a person's claim, the organization still needs to defend against it and respond to the complaint, which does take time and resources. But there are decisions coming out already. And so typically a human rights complaint can be quite delayed in terms of the decisions, and usually it may take 6 to 12 months or longer, usually longer, to get a decision on a complaint. But in Alberta, we saw two very recent human rights complaints from individuals who alleged discrimination on the basis of disability because they were denied access to retail stores that had a mandatory mask requirement or policy. And we saw decisions on those already, which is extremely quick. And the Human Rights Tribunal of Alberta recognized that people with disabilities may experience adverse effect from a mask policy. However, they concluded that alternatives to the policy were available and did not pose undue hardship on individuals as compared to the undue hardship for businesses to allow individuals to enter without a mask during the COVID-19 pandemic. And we've seen similar cases in BC and Ontario. So it's just an indication of the direction of human rights commissions on this topic, which I expect would be similar in the vaccination context. And then just two last things on the human rights topic. The College of Physicians and Surgeons in Alberta has stated that an exemption to the vaccine requirement is expected to be exceedingly rare, and that a patient's individual moral objection to vaccination is not considered sufficient clinical rationale for an exemption to the vaccine. And then somewhat similarly, on September 17th, the Saskatchewan College of Physicians and Surgeons published guidance for physicians regarding the request for a medical exemption letter. And they stated that there are very few recognized absolute contradictions to the COVID-19 vaccine. And they include, and it's the two that I'd already stated that were also stated in Ontario, the two being the severe allergy or a severe allergy or impact after receiving the first vaccine. Next slide, please. Okay, I see I'm going to speed up a little bit here, but in terms of drafting the vaccination policy or considerations in actually drafting the policy, it's important to consider a bunch of factors when you actually prepare your policy. So these factors include the scope. So who will it apply to? This kind of goes to that question before. So does it apply to anybody you have contact? Does it just apply to employees? Are you including any visitors that ever participate in an event? You need to think about the effective date. So are you giving people time to get vaccinated, or have they had time to be vaccinated already? Are you doing the single dose by this date, full vaccination by a subsequent date? And then what type of information you will collect. So this goes to the privacy considerations. Really think about what information you need and what information you don't need, and limit it to what is reasonably necessary. Provide in the policy, you want to provide a specific action that is required of those covered by the policy. So for example, clearly state that they need to disclose vaccination status, or do they need to provide proof of vaccination? So what exactly do they need to do to comply? You want to list a specific contact person in the policy that people can reach out to with questions, including privacy questions or accommodation requests. In drafting these policies, I typically like to include a note that the policy is not medical advice, and that you don't want people asking for medical advice from the organization, but rather they should be directed to a medical professional. And then in the policy, you also want to communicate the consequence of non-compliance. And so what happens if a person doesn't comply by a certain date? Are they required or allowed to work from home? Will they be placed on unpaid leave, termination? And then if termination, then just keep in mind that there are employment law ramifications that you need to be considering. Next slide, please. So kind of the last slide, other considerations, key factors to remember. The first one is just the rising trend in vaccination policies. This is definitely a trend, and it is going to be ongoing for hopefully not that long, but I would think several months. Policies need to be aligned with up-to-date public health recommendations. So the idea is that you want to implement this policy on a temporary basis. The idea is that it's a short-term solution or a short-term action that needs to be taken. And know that once you implement a policy, because things are changing so quickly, you need to continue to review it and update it. So it's kind of like this living tree that needs to be looked at regularly. Organizations should consider the number of active cases in their region and their physical workplace environment. So a vaccination policy may make sense for a certain business, and it may be required based on the province or the sector of operation. But for other organizations, it may not make sense. You really need to look at your situation. Even if you implement a policy, continue to consider other options and alternative measures to protect your workplace against COVID. So those admin and engineering controls, so the things we've heard about for the last 2 years, physical distancing, masking, all of those other ways of reducing the risk of COVID. And I think that's about it. And I just want to say again, this is just such a very dynamic area of the law right now, and it's recommended that you reach out to, if you have an OHS team or you have legal advisors, definitely reach out to them regularly because things are changing frequently.
Okay. Well, Krista, thank you very, very much. I know that this is not easy work, and especially in a country that is as diverse as our country, with provinces and territories, municipalities, and all kinds of other factors that affect these decisions. But I think you've given us a good way to think about how do we understand the risks, how do we understand what our obligations are, our duty of care towards people that work on our behalf, as well as the people that we serve. And so I think that you've set us up to ask the right questions as we move forward. I really want to thank you for your time and your expertise. We really benefited from that. And I also want to thank Deborah Pike, who's our Director of Stakeholder Relations and Knowledge Mobilization, who has been the convener and planner for our Volunteer Factors series. And again, to thank Canada Life for their support of the series, as well as BMS and the Under Our Wing insurance company that has also provided support for our series. All of you have been great in terms of your interest and sharing with each other your questions and your insights. And I just want to, again, as the outgoing, as an introvert, but the outgoing President and CEO of Volunteer Canada, I just want to take this opportunity to thank all of you for your active participation in Volunteer Canada's work, for all you do in your local communities and organizations and businesses to promote safe and meaningful volunteering, and wish you all the best. And with that, we will close. Thank you.